Hello, my name is Zoltan Arany. I'm a professor of medicine and cardiology at the University of Pennsylvania in Philadelphia. And today I'll be explaining what causes peripartum cardiomyopathy, or PPCM. This is a very important question because when a woman is struck by PPCM, she understandably wants to know why. She wants to know why, and she wants her family to understand why, and she wants to know how she can prevent it from happening again and prevent family members from having it happen to them. So what causes PPCM? Unfortunately, the answer is not totally clear. It's likely that more than one thing can contribute to PPCM, and in fact, likely that many things happen at the same time to contribute to PPCM. First, it needs to be said that pregnancy, for sure, demands a lot of extra work from your heart. By the end of pregnancy, your heart is pumping 50% more blood than normal to send oxygen and nutrients to your baby. That's about the same thing as if you were running a slow jog 24/7 nonstop. So in an important way, pregnancy is a type of stress test for the heart, and one can imagine how this might precipitate dysfunction or heart failure, like PPCM. But of course, every pregnant woman does that. That is to say, increase that work of the heart. But only about 1 in 1,000 women or so develop PPCM. So what's the difference? One answer we've come to realize in the past 10 years or so is the hormones of pregnancy. In fact, more precisely, the hormones of late pregnancy. At the end of pregnancy, the body of mom reprograms itself from taking care of the baby inside the body to taking care of a baby outside the body. And that requires a lot of changes, and rather fast. And the way the body pulls this off is by secreting hormones that tell different parts of the body what to do. So for example, a hormone called prolactin comes from the pituitary gland, which is in the back of the head. And it circulates through mom, and it gets mom ready to produce milk for the new baby. Another example is many hormones come from the placenta to prepare mom for delivery and then in fact to trigger delivery. There are many, many more such examples of hormones. And what we've come to understand over the last 10 years or so is that an imbalance in these hormones can cause PPCM. We still don't understand exactly how this is happening, but many, many researchers, including my own group, are working hard to understand this. Our goal is to figure out how to rectify these imbalances and prevent and treat PPCM. Now, as I said, there's more than one thing that can contribute to PPCM, and probably many of them have to happen at the same time. So in addition to hormones, one other important factor, which we've really only learned about in the last few years, is a genetic predisposition to PPCM. In other words, there are some inherited or genetic potential causes of PPCM. And this seems to be the case for at least 1 in 5 women with PPCM. Although I suspect it's in fact more than that, because we're still very early in learning about the genetics of PPCM. So if you develop PPCM, should you get genetic testing? This is a very personal decision that has bearing on you and your family. My recommendation is to think about it, to discuss it with your doctor, to discuss it with a genetic counselor. There's no right or wrong answer, but all women, in my mind, should know that it's an option and that genetic testing is available. As I said, we're still early in learning the contribution of genetics to PPCM. So, do hormones and genetics explain all of what causes PPCM? Unfortunately, no. And we understand even less of the other factors. For example, there may be viruses that cause infections that may precipitate PPCM, but we really don't understand this very well yet. And there are other factors, such as where you live, that can play a role. There is a lot that we don't know. So to recap, PPCM is likely caused by a combination of an imbalance of hormones of late pregnancy, of possible genetic predispositions, and likely other factors that we still don't understand very well. You know, one of the many reasons that my colleagues and I started a PPCM registry is precisely to learn more about what causes PPCM, and to learn directly from the experience of women with PPCM so that we may one day cure this disease. If you aren't already logged into the registry right now, you can visit the registry at ppcm.org. Please join us.